Hey everyone, we've got another heart today. This is number 1581 in the collection, and we'll do a quick teaser and preview of the main phenotypic feature of this heart. And here we've got a right-sided aortic arch with a retroesophageal left subclavian. So we have a right aortic arch defined as by being an arch that curved around the right main stem bronchus. Here's the ascending aorta. Here's the left common carotid. Here's the right common carotid. Here's the right subclavian. And then behind here is the left subclavian artery that would, of course, behind the esophagus to the left arm. And then we have a left-sided arterial duct here as well. But that's our preview. We'll come take a look at the arch again in more detail. But let's start off with how the heart would have sat in the chest. And we can see that we have the lungs still attached to this specimen. The heart would have sat roughly in the chest like this. Anterior surface coming out towards the screen. Posterior surface towards the turntable. Head or superior here. Legs are inferior down here. Left over here and right over here. So let's start off as I like to, which is by identifying at least externally what appears to be the morphologic right atrial appendage. Here we've got an atrial appendage that's triangular, broad-based, or pyramidal in shape, consistent with a morphologic right atrium. When we go ahead and open this up, we do find that there's pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. Here we find the oval fossa. And we find that there is, in fact, an oval fossa atrial septal defect. Elsewhere in this right atrium, we do find the mouth of the coronary sinus back here, guarded by the Thebesian valve. And you can see this is a little bit more prominent of a Thebesian valve than we normally see. And then here is the tendon of Totaro. And the tendon of Totaro, the mouth of the coronary sinus, and the right-sided atrioventricular junction form the triangle of Koch, and it is at the apex of this triangle that we expect to find the atrioventricular node. So in this heart, we would expect the atrioventricular node to live here. And then real quick, here's the superior caval vein here, draining into the roof of the right atrium. Now, when we take a look at this right-sided atrioventricular junction, we find that it's guarded by a valve that has 3 leaflets, 1, 2, 3. There are direct connections of this valve to the ventricular septum, consistent with a morphologic tricuspid valve. And the ventricle that it opens up into has coarse trabeculations and a septomarginal trabeculation, aka a moderator band, consistent with a morphologic right ventricle. And here is the septomarginal trabeculation and its cranial and caudal limbs. And this is also known as the Y of the septal band. The right ventricular outflow tract isn't opened up well, but there is a normal trileaflet pulmonary valve here. And then here is the pulmonary trunk that has been transected. We'll flip this heart over. And here we find an atrium that's smooth-walled. We do see the atrial septal defect here, which is in the oval fossa. The smooth-walled atrium is consistent with the morphologic left atrium. And we can see the pulmonary veins draining into the roof of the left-sided atrium. And here's the left atrial appendage. Then we'll take a quick peek at the left ventricle. Here we've got a ventricle with fine crisscross trabeculations, consistent with the morphologic left ventricle. And then we've got an arterial valve with 3 leaflets, 1, 2, 3, consistent with aortic valve. And we can see that there is, in fact, a coronary artery arising from the sinus of this valve. And as we usually expect, this aortic valve isn't supported entirely by muscle. It does have fibrous continuity with the anterior leaflet of the mitral valve. And as we've discussed in the past, just to point out again that the arterial valves don't actually truly have a round or oval-shaped annulus. Their annulus, which is the junction between the fibrous valvar leaflets and the myocardium is actually crown-shaped, because the fibrous valvar leaflets are kind of half circle-shaped and have these triangles of myocardium interposed in between them. So truly the annulus is crown-shaped or a coronet. The round or oval-shaped annulus we create is a human-made structure, which is better called the basal ring, and while it's clinically helpful, is not a true anatomic entity. And then here is the ascending aorta. So now let's go ahead and take a look at the aortic arch again, since that is the area of focus. And so here is the ascending aorta. Here's the transverse arch. Here's the descending aorta. And this is a right-sided aortic arch. And here are the head and neck vessels. So here's the ascending aorta. Here's the left carotid. Here's the right carotid. Here's the right subclavian. And then behind it, we find the left subclavian that then, here's the left subclavian that then courses behind the esophagus. So once again, ascending aorta, left carotid, right subclavian, and then when we go behind here, we find the retroesophageal left subclavian. And so here we have a heart with a right side aortic arch with a retroesophageal left subclavian.